in my mind, consumer-driven healthcare is anything that takes money away from the insurance company and puts it in the consumer's hands to spend as he or she wants. So the insurance company is not making the decisions, the consumer is making the decisions. All right, and this has been enormously successful, far more than I ever expected. Lower costs. The Kaiser Family Foundation does an annual survey of employer benefit plans. It found, this is a year ago, that the average premium for a health savings account, the insurance that goes with the health savings account, was $9,100. The average premium for an HMO, this is family coverage, was $13,100. A savings of $4,000 a year per family. The Mercer Company did surveys that found that consumer-driven plans have a rate of increase, what's known as a trend from year to year, at half the level of HMOs and PPOs. It found that people are saving for the future. The Consumer-Driven Market Report found that as of the first of this year, $9.2 billion were being held in health savings accounts. So people can spend that money for their future needs. They're saving their money for their future needs. They're good for the sick as well as the healthy. There was a big article in Health Affairs a couple years, actually about a year ago, that found that, and this is written by people that don't like consumer-driven healthcare, but they found that consumer-driven healthcare is lowering the out-of-pocket costs for the very sick. It's good for the poor as well as the wealthy. If you have an opportunity to save $2,000 a year that would otherwise go to the insurance company, and you can take that away from the insurance company and put it in your savings account, that is real money to someone making $30,000 a year, $40,000 a year. It's not a big deal to someone making $200,000 a year. Working people love this stuff because they can use that $2,000 a year. They've got things they can spend it on. It's good for alternative and innovative care. There's no restrictions on your choice of doctor or your choice of treatment. You can spend it on a chiropractor or an acupuncturist or a nurse midwife. The person doesn't have to have a contract with an insurance company. It has been raising participation in information and wellness and prevention programs. People are paying attention, they're researching costs, they're looking for their treatment alternatives, they're becoming intelligent shoppers about healthcare. Better compliance, better health, by the way, this is all super well documented. I've got research papers I'm happy to share with you that lays all this out. And finally, it is growing like moxie. The Center for Disease Control does an annual survey, National Health Information Survey, massive study. Last year it found that 20% of the under 65 population now have high deductible plans, which they define as $1,100 per person or more. 20% of the under 65 market. I mean, this is phenomenal growth, considering it's only been around for about 4 or 5 years. Drop me a note if you'd like any of this information. I've got a weekly newsletter, an email newsletter that goes out. Happy to share it with you, and we'll leave it at that and look forward to the questions.
Thank you, Greg. 170 studies, you say you read on Medicaid effectiveness. You know, I've read Greg's weekly newsletter for years, and I've followed Sue Blevins' work as well. You know, they've been slogging through regulations, reports, laws, studies. I mean, while I was sleeping, maybe just focused on living my life, these guys were kind of walking the perimeter for us, looking at issues about healthcare freedom, immersing themselves in a mountain of details, because they saw on the horizon threats to our freedom. And I just wanted to take a moment and note that, because the healthcare issue is extremely exciting right now when we're in the midst of the Baucus bill and it passes today. But it wasn't such a big deal 5 years ago. But they knew it was coming, and they did the work, and they did the diligence of slogging through reports that would be absolutely incomprehensible to me and maybe to some of you as well, and I want to thank them for doing that. Sue Blevins is the president of the Institute for Health Freedom. She has master's degrees from Harvard and from Johns Hopkins. But what really is interesting to me about her is that she was a nurse in the United States and in Canada. So she has seen the system from the most front part of the front line and didn't like what she saw and thought that there was room for improvement and began to wonder about public policy and economics and how does this system really work, and applied herself and became extremely well educated on this issue and runs a think tank in which she educates people on this. And I think that's extremely important to have experts like this who have actually had hands-on work in the industry and in healthcare, literally hands-on work. No one's more hands-on than a nurse who's taking care of everything imaginable when you're sitting there, when you're laying there in the hospital, but also have the understanding of the economic principles and the global picture. So I'm very happy, and especially I've always been impressed with Sue's compassion for the patient, which I think you'll see in her presentation, and anyone who's seen her here before, that really shines through, and we're very happy to have her here. Sue Blevins from the Institute for Health Freedom. Please join us.
Well, good evening, and thank you, Sep, and thank you all for attending. Just a quick note, I just want to share many, many years ago, back in the 1980s and early 1990s, when I worked at Johns Hopkins Hospital, I had people tell me very intimate details, very private matters, and I can tell you right now that way back in the 1900s, with paper records, people were hesitant to share intimate details. So as we move forward and look for ways to improve healthcare through technology, I just want everyone to keep in mind how important privacy is, why it matters, and I want to say up front, I love technology. I'm using it here. I love an ATM machine. I think it's wonderful. But please think about people who need care. They want to go in. They want to share intimate details. And as we move forward with health reform, how we're going to change that relationship, the doctor-patient relationship, and everyone's privacy. Well, as you know, in the recent national healthcare debate, we've heard a lot about how health reform would affect everyone's freedom of choice, their pocketbook, and maybe rationing. But how many of you have heard anything about privacy? Not a single hand. I'm so glad you came tonight. And you're not alone, by the way. I've given this talk to a number of groups recently, and it's just not making the front lines. I do have an op-ed coming out on it, but it's really not making the front lines. But it is a very important issue. Hasn't gotten enough attention, and I'm going to talk about that. I want to begin by asking this question. I don't want an answer, but I just want to pose this question. What do you think about the idea of having a national health information electronic super information highway that would allow everyone's personal health information to be tagged, tracked, and exchanged with more than 600,000 health-related, including health insurance organizations, without your consent? Okay, I see some thumbs down. If this concerns you, you'll definitely want to consider how a federal health insurance mandate would affect the doctor-patient relationship and everyone's health privacy. It's vitally important to realize that a federal health insurance mandate, combined with some other requirements that I'm going to be telling you about in the leading health reform bills that is getting ready to become law, folks, would effectively eliminate everyone's health privacy rights.